All right, so this is Dr. Poon. I'm Director of Cardiovascular Imaging at Lenox Hill Hospital. And today I'm going to look at what we can see. And this is a very interesting topic in medicine, even though a lot of the diseases based on history and physical, but the technology has really allowed us to see things that can make our diagnosis a lot more accurate, and which is the subject of my talk today, and I hope you enjoy it. And this is something that I've been working on for the past 25 years, and you can see that the three pictures in front of you: a human and an owl and a pigeon. And if you look at them, you probably would not be able to guess who has the sharpest eyes. Well, it turned out that pigeon vision is the most superior compared to both the owl and men. And the pigeon has a peripheral vision, which is really phenomenal. It can see things behind its head. So, which is why the pigeon can see things and can fly, and it's very hard to catch a pigeon because it's almost like it has an eye behind his head. Man actually has a very poor peripheral vision compared to a pigeon. But what makes men so superior is our brain. And this is really the subject of today's talk. What our brain make up for the apparent weakness of our vision and other, a lot of physical activity. Humans are actually not very good compared to the other animals, but our brain is far, far superior. Well, today, in order to talk about the different kind of imaging, it's important to understand how to generate the image, and so that you will be able to now look at the image, have a better understanding of how the images come about. And the first one that I'm going to talk about is ultrasound. And this is basically a device that generates tremendous fast sound wave that human ear would not be able to hear. But using very sophisticated computer system, you would be able to analyze the sound wave, both the forward and backward rebounds sound wave, and create an image. And you can tell the distance, and you can actually discern the small object very precisely just using sound wave. Well, look at what we are using this technology for in everyday's world, and police is actually using the same technology to find out how fast you are driving your car. And certainly a lot of driver has the reverse technology of the same device inside the car to figure out whether the police is trying to catch him. So it's almost like a cat and mouse game here. So the technology is everywhere, and we are using it, but in the medical world, we are using it a little bit differently. We are using it to look at small objects. And if you look at this ultrasound image of a fetus, a little baby inside the mother's womb, and you can see the ultrasound can give you a very clear picture of the baby. Just using this sound wave, forward and backward, you subtract it and you'll be able to generate a clear image. And this is a very simplistic way of explaining something which is highly complex, but this is basically the principle of ultrasound image. The next two images are coming from two Nobel Prize, and one is CT, which was the Nobel Prize winner in 1979. And the other one is MRI, which won the Nobel Prize. The person who discovered MRI imaging got the Nobel Prize in 2003. And they both sort of look alike on the outside, but inside and how it generates image are very different. And it's very important to understand the principles so that now you understand why we need different images in order to see the heart or any body part clearly. And to see the inside, that's really the goal of the images. And this is an X-ray, which is generated by two beams, anode and cathode. When they hit each other, the electron beams split into X-rays and many other rays. The X-rays being collected and transmitted outward through an object, and then you have a little film on the other side to catch what happened after the X-ray beam passing through an object, in this case, like a human foot. And this is the same principle is being used in CAT scan, or what we currently use a lot in the invasive laboratory, the catheterization laboratory. So these are some of the images that you would see if I pass an X-ray through your chest. You see something like this on the far left upper corner. If I go through your head, it'll look like this with the bone and the eye socket and the jaws. If I pass through the X-ray through your foot, you get the X-ray of your foot. In case you have foot pain, you worry about whether you have some kind of fracture. X-ray would be the first test. Even when you go see a dentist, you can see the X-rays being used to see if you have cavities. So this is the technology that's being used very broadly in medicine. Well, when you're passing through the airport security system, well, they do the same thing. They have these type of X-ray machine that can see whether you're hiding something on your body or the suitcase. So this is the same technology being used every day for different purposes. But in medicine, we're mainly interested in the human body. So let's talk about CAT scan. And this is a conventional CAT scanner, look like a gigantic donut, and your body sort of lying on a couch, and they slide you in and out of the CAT scanner. And with the X-ray beam inside the CAT scanner machine, we would be able to see the inside of your body, like this human head that you see on the right. Well, I'm going to show you some interesting images. So the one on the left is X-ray fluoroscopy that we use in the cath lab to look at the inside of a human heart. And you see these wire, this patient had an open heart surgery. These are the wire to hold the bones, to the chest bone together. And if you look carefully, you can see something flopping inside the chest. These are the two mechanical valves that are controlling the blood flow in this person's heart. One of the valves are not working, and it's not very easy to see using fluoroscopy. And this is a scan that I did last year using CAT scan, and you can see the same two valves in the same individual now look like this. Pretty amazing, right? And basically it's a technology using X-ray, but now you get a 360-degree image of the two valves, and you can rotate it any way you like. And if you look at it very carefully, the one on the left is not working properly. One of the leaflets is sort of stuck. And that's why this patient is having symptoms of shortness of breath. And this patient later on needed a reoperation to replace this not functioning properly valves. So just to show you how imaging become very important, you don't want to go in to look for the problem. You really want to know ahead of time before you take the patient to the operation and perform an open heart surgery that usually takes hours. And in this case, we were able to use very sophisticated CAT scan technology to diagnose that one of the two valves are not working properly before we take the patient to the operation. And we know ahead of time what we need to do. And this is how the inside of the operation, the surgeon is looking at this valve that I was able to diagnose before the surgeon went in to remove the old mechanical valve and put in a new one. So you can see that having X-ray vision is very important, particularly dealing with a lot of patients with complex medical problem. And you really want to know what's going on before you do anything invasive. The next technology is MRI. This is a very sophisticated technology that based on magnetism. And I will talk a little bit more later how it generates an image, which is different from ultrasound, right? Which is sound wave, ultrasound wave that you cannot hear, but the computer would be able to figure out from the change in the sound wave going forward and the rebound sound wave and reconstruct the image. So sound wave is easy to use, and the ultrasound machine is very small, is portable. You can move it to the patient easily. Both CAT scan and MRI are large. They require a very large gantry, which is the donut, with very sophisticated machinery inside. In the case of CAT scan, there's a very fast rotating donut that going at the speed of less than half a second per revolution in order to cover the entire chest at a speed that you can freeze the motion of a beating object like the heart. On the MRI is similarly a gigantic magnet that you're going in, and I'll talk a little bit more how it generates an image. This is MRI machine on the left, and inside you have a very powerful magnet. You can never, you should never walk into an MRI room with a metal object, because that metal object will fly out of your body and can hit the machine or anything in its way to the machine where the magnet is and can hurt someone. So you really have to make sure that you don't have anything magnetic on your body before you walk into a MRI room. That magnet is so powerful that even a stretcher can literally fly off the floor and stuck to the magnet. And if you bring a metal stretcher into an MRI room, and can cause serious injury. So when you're inside a magnet, there's magnetic field that cause your proton in your body to line up in certain way. And just to show you how powerful the magnet is. And inside the MRI machine, there's ultrasound generator, similar to the echo that I was talking about, except this is a lot faster and higher in frequency. And when the ultrasound hit the body, it causes the proton in your body to start spinning. And once it starts spinning, it creates some kind of motion that the MRI machine will be able to detect. And as such, it will create a nice image like what I'm showing you here. These are all images from our laboratory. So you can see on the left, the MRI image of the contrast going through a human chest. And you can see how the blood carrying the contrast flow, and you would be able to diagnose any type of problem with the circulation and with the heart. On the right is an even more advanced technology that we started about a year and a half ago. Now, instead of a two-dimensional images that you see on the left, you can create a four-dimensional, right? Three-dimensional over time is four-dimensional. So the heart is a three-dimensional object, and you see it beating. So that's the time dimension. So you can see how you can rotate and see the blood flow inside the chest using this four-dimensional MRI technology that only became available about a few years ago. We are one of the group that research on using this technology. So I just want to show you how this is the MR image of the blood flow in a patient. And you can see the flow of blood and how it is not straight. It actually like a spiral. And if the flow is not normal, because if you have some valve problem, or if the blood vessel become very stiff from high blood pressure or high cholesterol, you will see the flow pattern to be very abnormal. You see the red color is very high velocity, and as the velocity slow down, it turns into other color. So this is very useful to determine what the velocity, whether it's dangerously high, and if it is dangerously high, the patient would need to have a valve surgery to fix the valve so the velocity does not become too high. As the velocity get higher and higher, it causes a lot of shear stress on the wall of the blood vessel, and with time, it can cause the blood vessel to dilate, turn into like a balloon. And if you don't control it and it continue to grow, eventually it can rupture or blow. And when it rupture, that's not good. And so this is the technology that we are using to look at the blood flow inside this main vessel called the aorta to figure out if the velocity of the blood flow is normal or abnormal. So as I'm showing you the different technology, as you can see, become more and more complex. And this is something that I'm sure you all heard of, and this is the technology that self-driving car is currently using. All right, in order for the computer to drive the car, the computer needs to look at what is in front and figure out where the road is and what are the objects that you should not get near, like a guy riding a bicycle, let's say, or some car park on the street. So you should stay straight on the road. And so you can see that there's a lot of complex computation, figuring out what is normal, what is not normal, what your car should be heading, which direction you should be heading. And so this is the same technology that we are currently using in medicine, which is like this is a beating heart. And in order to figure out how the heart is working, we now have artificial intelligence that detect the motion very precisely, and almost like the face recognizing software that can figure out who you are, and a lot of the bank and security system are using to detect and to differentiate one person from another. And we are using the same type of facial recognizing software for the heart so that we don't have to painstakingly to do the contour to drawing the circle. Now we can use the computer to help us to calculate your heart function very precisely. And we also use the same software to calculate flow accurately. So just look at these two images and you can see the heart is beating, and in order to calculate the blood flow, the leak of a leaky valve, you would need a very complex computer system to track the movement of the valve and also find the contour of the heart precisely so that you can get a good estimation of the function of a particular heart. And we know what the normal function is. And if the heart is not beating normally, we can compare to the normal function. And at a certain point, we would have to decide whether this person needs more medication or invasive procedure. And on the right is another CAT scan image that you can see generate from the CAT scanner that I shown you earlier. That you can see how the heart is beating, rotating. So this is like a three-dimensional over time. And you can see the blood vessel. This is one of the vessel coming off the aorta, supplying blood to the bottom of the heart. And we use the same kind of technology. We can actually track the blood flow inside this vessel and determine if the blood flow is adequate or not. So artificial intelligence is a major part of everyday cardiology now, and we are using it to help us to look at heart function, to determine blood flow in large vessel inside the heart or in small vessel supplying blood to the heart. Now we're going to talk about a very important part of our culture. Obesity is a major health problem, and because of obesity, often you develop diabetes, which is a problem with your body handling the amount of blood sugar. And because of the high-fat diet, and also as you get older, your body is not going to be able to metabolize that much fat and calories. And this creates a major problem in the United States, in fact, worldwide. Heart disease is a major killer in the United States and in most of the Western civilization. And now using CAT scanner, the same that I showed you earlier, we would be able to see and detect early disease in the blood vessel. This is work I did almost 14 years ago. Using the CAT scan technology, we start to look for early plaque occurring in the blood vessel. So this is the stage that you can do something, either by changing your diet, increase your exercise, or start taking medication. If you cannot change your diet or exercise enough to decrease the cholesterol level and sugar level in your body. but you need some way of looking inside to see if you are at risk of developing heart problem. In specific, the problem with the blood vessel to the heart. Heart attack is basically a blockage inside this tiny vessel and blocking the blood flow, and your heart is not getting enough blood, and they start to give you pain. And so you don't want to wait until you have symptom to start doing something about it. So the CAT scan is now being used to detect this type of plaque buildup early on, so that the doctor can work with the patient and help the patient to start to change the lifestyle, and also maybe start taking some medication to decrease the plaque from getting worse and worse. So this is a scan that we do to many of our patients, and using the software and artificial intelligence, we can now quickly figure out how much plaque is building up in the blood vessel. It's a very fast test, take less than 5 minutes to do, and we would be able to risk stratify an individual to high or low risk. If you're low risk, that means you don't have much plaque, then it's good news. And you can continue doing what you're doing and not have to worry about everything you do. But if you have plaque buildup already at an early age, that is less than the age of 40, you have to be careful. And because it won't take long before these plaques become so big that it starts to obstruct the blood flow, and you will have symptoms of chest pain every time when you try to exert yourself. And that's classic symptom of angina, which is lack of blood supply to the heart. And you get pain in the chest. And every time when you try to exert yourself. So I just want to show you some of the images that we are currently using the CAT scan to look at the blood vessel. And this is a patient who had chest pain, and we were concerned that this patient has blockages. And when we did the scan and look at the blood vessel using the technology that I talk about and artificial intelligence, we were able to see that the blood vessel is very, very healthy, and there's no plaque at all in all three of the main arteries to the heart. So this is good news, and nothing to do, and just continue healthy lifestyle, and you'll be fine. And if you look at inside of the blood vessel, the cross-sectional view in one of the vessel, you can see that is perfect circle with no plaque anywhere. On the other hand, this is a patient who presented to our emergency room with chest pain. And when we scan the patient, you can see that there's something not normal in one of the main vessels. And if you enlarge this image, you can see that there's plaque. These dark color, black color deposit is coming from the cholesterol in the diet. And when the cholesterol build up, in the blood vessel, it stick to the wall. And with time, it become more and more. Eventually, it blocked the blood flow down this vessel. So you can imagine the muscle that relying on this vessel to get the nutrient and is now suffering because there's not enough blood. So you can see that we can use CAT scan non-invasively visualize what is going on inside a human heart, and would be able to tell what needs to be done. And this patient, if you cut across this area, you can see that there's really not much blood. This white area is all the blood can go through. The rest are completely obstructed from the cholesterol plaque. So this is a very important image. And once we look at this, we immediately send this patient to the cath lab. I think last week you heard the talk from Dr. Verinder Singh. He's one of the interventional cardiologists who work with me. And he will take this patient to the cath lab and use the wire and the balloon to open it up and put a stent, which is like a scaffolding, to keep the plaque from coming back. So that's a teamwork between non-invasive cardiologists to do this type of diagnosis quickly using a CAT scan. And this patient was seen in the emergency room. We were able to do the scan while the patient was in the emergency room. And once we made a diagnosis, the patient was sent to the laboratory for the cath lab for the invasive procedure to open up the blood vessel to alleviate the chest pain. So these are some of the images that we use the CAT scan for, and this is one that I did many years ago, that you can see the back of the heart and the blood vessel coming in from the lung. These are the pulmonary vein. And this is very important. If you go to medical school, you'll learn that these veins are often the cause of irregular rhythm. And in order to stop the irregular rhythm, we need to take a picture of the heart and the vein and to see how they look like, so that the interventional electrophysiologists, these are the cardiologists who specialize in electrical problem with the heart. And this on the right is the inside the lumen view. So you can see that, and on the right side, there are two branches. So if you look from the inside of the heart, you can see the two holes that lead to the two veins. And this is very important for the invasive electrophysiologists, because they need to know, they need to size it. They need to know how big and what kind of catheter they need to use in order to go in and get rid of the irregular rhythm. So this is another image of the left heart, particularly the left atrium, which is the chamber sitting on top of the ventricle. And you can see the vein now coming from behind, and there's appendage. This is a little small chamber on top of the left atrium. It doesn't really do anything, but it can be the source of stroke. If you have irregular rhythm, the blood doesn't flow normally, it can form clots, and the clot can sit inside the appendage. And if you're not lucky, it may break off and then get into the bloodstream and end up in your brain somewhere, then you will suffer a stroke. If it goes to your leg, then you will have ischemic limb. So this is very important. And that's why we need to get the image to see if there's any clot in the atrial appendage, and in order to decide what kind of treatment we need to offer to this patient. If there's clot, then you have to treat the patient with blood thinner, and which is a medication which thin out the blood, and with time, the human body would be able to slowly dissolve the blood clots in the left atrial appendage. And this image is also allow the interventional electrophysiologist to decide how and which of the pulmonary vein they have to go after in order to get rid of the irregular rhythm. And this is another CAT scan image from my file, a patient who had a very tight aortic valve, which I shown you earlier from that 4-dimensional MRI images. Do you remember I talked about when the blood velocity is very high, like the colors start to become red? You have to look at the valve to see if the valve is opening properly. And in this particular patient, the valve was not opening fully. With age, the valve becomes calcified and it doesn't open fully. And because of that, it generates a jet of high velocity. And with time, it could be very damaging to the body, to the blood vessel. It can cause the aorta to balloon, to dilate, become an aneurysm. And the one way to fix it is to put in this type of stent graft. So it basically is a scaffolding that you put through the either arm or the leg, and then you expand it and literally crack open the O valve, and inside the this scaffolding, there is a artificial valve that you put in. So now you can replace an old stenotic valve with a brand new prosthetic valve using this like a scaffolding and with the valve in the center. So this is a very popular procedure now, and it pretty much rely on the imaging technique that I talked about in order to plan and to size what kind of scaffolding that you need to put in order to fit it perfectly. Just imagine if the valve is too small, it may come loose. And if it is too large, it may break the native blood vessel. So it has to be sized perfectly before you take the patient to the laboratory for the procedures. So it is important to see how imaging become very, very critical for a lot of the invasive procedure, for planning, for deciding whether someone should or should not have the procedure. And if the patient should have the procedure, what kind of valve you need to put in. There are many different types of valve, artificial valve that we can put in now. So depending on the patient, we have to pick and choose the best one available. So imaging become very important for that. And also afterward, we oftentimes need to use the same imaging to decide if the valve is working over time. And this is an image of using CAT scan to see if this patient is a suitable candidate for that procedure. And it turned out that, look at this patient had very tortuous blood vessel, meaning that the blood vessel normally should be very strict. But with time, due to either high blood pressure, aging, high cholesterol, some people, the blood vessel become very tortuous. It's like a corkscrew. And this become problematic. for the invasive procedure. So you cannot put a catheter up this vessel because in order to get to the heart, you got to go in somewhere. So either through the leg or through the arm. So we first look at the leg because the leg has a much bigger vessel. So we always prefer to go through the leg. If the leg's vessels are too tortuous, like in this case, then we go through the arm. And if the arm is no good, then we have to direct puncture through the chest wall into the heart. So again, imaging become very important for us as a team to decide which approach is the best and the safest for the particular patient. And we also have to know whether there will be any danger putting in the artificial valve. This is on the left, you can see that this a triangular shape, this is the valve that we are aiming for to replace. And you can see some white stuff, which is calcification formed on the leaflet, causing the valve to not be able to open fully. So we need to look at what kind of valve would fit perfectly and not blocking the flow to the coronary. So we don't want to create another problem with the procedure. So a lot of the thinking goes into deciding whether a patient is a suitable candidate for this type of very advanced procedure. Again, imaging play a very important role preoperatively and postoperatively. Now, this is a patient born with a stricture, which is a narrowing in the descending part of this aorta, this blood vessel. This is the same blood vessel that I shown you earlier, the 4-dimensional images with the red and yellow and green color. It was going through this vessel. And you can see that this is a congenital, meaning something that you're born with. And what happened is because of this narrowing that you're born with, the blood cannot go from the top to the bottom part. And so as you imagine, the head is on the top, the leg is on the bottom. So the blood coming out of the heart go to the aorta, some of the blood go up to the brain, and majority of the blood make a U-turn, go downward to the leg and other vital organs in the belly area, like your liver, your spleen, your intestine, your gallbladder, your bladder. So this is really a major conduit to carry blood to the rest of your body. So when you have a narrowing here, your body will find some way to get the blood to the bottom. And this is what I call survival of the fittest, right? And your body gonna, hey, I'm gonna find some way to get the blood from top to the bottom, bypassing this stricture. And with time, it can be very large. This is not a normal vessel of a normal human being. This is unique to someone with this type of congenital problem. But again, the imaging become a very important tool for us to identify where the problem is, and also if this patient has any other problem, that if we're gonna go in to fix this, we don't want to fix it, and then 5 years later, oh, there's another blockage that we forgot to fix because we didn't look. So CAT scan become a very important tool for patients with congenital heart problem so that we can visualize the internal structure and other potential, what I call booby traps, right? So you think that you're fixing all the problem is here, but actually there are other problems. For example, a lot of patients with this type of stricture also have valve problem that you need to know ahead of time. So you don't want to fix this, open up the chest to fix this, and 5 years later you have to reopen the chest to fix something else. So this is another patient with a who had a bypass, right? Basically, this patient had a blockage, something that I mentioned earlier, from high cholesterol, from diabetes, and from lack of exercise. You develop blockage in the native coronary, and this patient had a bypass surgery. So the surgeon went inside and took one of the blood vessels from the chest wall, for the internal memory artery, and graft it and basically bypass the blockage. So now the blood can go from the one of the vessels going to the arm, bringing blood to the heart, bypassing the blockage. So this is a common surgical procedure we perform for patients with severe blockages in the blood vessel. So this requires cardiothoracic surgeon who take the patient to the operating room, open up the chest, and take out the graft from the chest wall, and then graft it to the native blood vessel. So this is another way of fixing coronary blockages. And you can see this patient, we are using the CAT scan technology to look at the inside, because the patient was having pain. So we want to know if this graft is still working after 10, 15 years. Well, believe it or not, these vessels, actually, these grafts last for quite long, 25 or more years. But some people, because of the cholesterol or diabetes, the same risk factor that caused the initial blockage can lead to blockages inside the graft. So we need to have a way to visualize it so that we know what to do with it. Is it severe enough that the patient need another operation? Can we fix it using the catheter that Dr. Singh talked about probably last week? And basically using a wire and catheter to go inside the graft and open it. So this is something that non-invasive imaging, again, play a very important role to see after surgical procedure whether the graft is working or not, and whether there's some other problem besides the graft is causing this. Is it because another blood vessel is not flowing blood so smoothly, which need to be fixed? So you can see that, again, the imaging is very important non-invasively to make a lot of these important diagnoses. So this is an image of the aorta, which I showed you earlier. This is a patient with an aneurysm, which is dilatation of the blood vessel. And on the right is the flow that using MRI, we were able to see what was going on with the flow. You can see that when the blood is leaving the heart, there's a jet that pushes the blood into the ascending and then go around the arch and go down the descending aorta. So this is high velocity. So we are using this imaging to diagnose that the valve is not opening fully, causing a high turbulence and jet that projecting outward into the ascending aorta, causing this aorta, which is like a pipe, to enlarge over time. And we need to do something about it. So we either lower the blood pressure, or at some point we would have to change the valve so that it doesn't continue to create this high turbulence and causing the blood vessel to enlarge and become dangerous. Once you get to a certain point, we have to worry about spontaneous rupture. And it can happen while you're playing golf, and suddenly the rupture. If you're lucky, you get to the emergency room and the surgeon fast enough, they can fix you. If you're not lucky, that will be the end. So it's very important to have non-invasive way to follow this type of potentially life-threatening pathology over time. And at a certain point, we would have to sort of bite the bullet and say, look, I know you're not having symptom, but seems like your valve is getting too tight and it's generating such a high velocity jet, damaging your aorta, and we should change the valve before the aorta may rupture. So those are very tough decisions. We often do these type of non-invasive imaging. We'll pick and choose. Ultrasound is the easiest, right? And it's a tiny machine. I can move from room to room. But the image of ultrasound is not very good. It's not as clear. It's not three-dimensional like the way the CAT scan and MRI are able to give you a panoramic view of the entire body so you can see other pathology. So ultrasound is fast and quick and easy to obtain, but not much detail. CAT scan is very detailed and fast, because you use X-ray, which is speed of light, and you can see object very, very small. The only problem with CAT scan is require you to give contrast, which is not good for the kidney, and X-ray is damaging if you expose your body to too much X-ray for too long. So we try not to do CAT scan too often. And even though it's fantastic, it's fast, if you come to the emergency room with chest pain, we do it because we have to make a decision quickly, and the risk-benefit ratio favor getting an answer quickly, then you suffer a massive heart attack. So we'll do CAT scan quickly. But if something that we can wait, we don't have to give contrast that could be toxic to your kidney, we may consider MRI at a certain point for certain individual. For example, this patient with aortic aneurysm, I've been doing MRI every year. Now, MRI has no radiation. Magnetism is completely safe. The only thing not safe about MRI nowadays is, again, the contrast that MRI uses, gadolinium. It's been shown that in patients with kidney problem, with severe kidney problem, you shouldn't use the MRI contrast. So there's some restriction, but if you have normal kidney function, it's not dangerous, and MRI has no radiation. So you can have MRI literally every day, right? And basically just magnetism and ultrasound induce images. So there's no harm to the body per se. And so MRI is good and more, it gives you a larger field of view than the echo, but it takes longer to obtain. It takes about 45 minutes for cardiac MRI study. On the other hand, CAT scan takes 5 minutes to do. So CAT scan is by far the fastest imaging we have, and MRI is slower, but it's also very detailed. Ultrasound is portable, fast, but it's not very detailed. So you can see that the different non-invasive imaging techniques really work hand in hand. They complement each other. You know, if you want some fast diagnostic information, and the patient is in bed, in a hospital bed, and cannot be moved, then you move the ultrasound to the patient. If a patient can be moved, then you move to the CAT scan, which is very fast, and you get the information right away. And if the patient is stable and you don't want to risk harming the kidney, and you don't think the ultrasound gives you detailed information, then you do MRI. So you see that all different techniques just give us more option to help take better care of our patient. So we do the good physical and history, and then we start using different imaging modality to help us to make a correct diagnosis before we either send the patient home or send the patient to the invasive team that either do diagnostic tests or intervention like catheterization or surgery. So this is really all I have to share with you today, and I'm here to open up to answer any question in case you have for me. Thank you.
All right, I just opened up the chat function. If you want to stop screen sharing, you should be able to open the chat and see all the questions as they come in.
Sure.
I know we're getting close to 12, but you can answer just a couple questions if you want.
Okay.
Did you see the chat?
Yeah, I see a lot of things coming in, a lot of thank you. So they're coming in like fast and furious. I can't even, I can't
Yeah.
even.
If you scroll up, it'll stop like jumping through the chat.
Uh-huh. Let me see. Oh, okay, yeah. All right, so I see a question. Someone asked me, what can cause the mechanical valve not working properly? Well, you know, scar tissue form around the mechanical valve after the mechanical valve was put in by the surgeon. So sometimes the scarring can cause a little interference of the valve, you know, because you can't really predict how the scar gonna form. So you can only do the surgery and hope for the best. And some people, they form scar very aggressively. And then the scar tissue invading into the mechanical valve can cause obstruction and normal functioning of the mechanical valve. That's basically what happened. It's no fault to the surgeon or the patient, you know, who can predict how your body react to the surgery and the mechanical valve. So that's why. So someone asked me, can plaque build up in an individual heart's artery if they eat plenty of food, but at the same time exercise? Well, you know, exercise is very important, but you know, you can't really change your genetic. Some people can exercise a lot and still get plaque buildup. And I have seen marathon runner and at the Olympic level, not just, you know, just go out run for fun. And these people train 5, 6 hours a day and still get plaque buildup. So it's one of those things that we're trying to do the best we can, right? We're trying to watch our diet. We're trying to exercise. We're trying to control the blood sugar, control the blood pressure, and do everything we can. But, if you have the family history or bad genetic, you may get it. And that's why we have imaging that's going to help us to diagnose, even though you could be doing everything right. You could still get the wrong answer, so to speak. So I think that's why non-invasive imaging becomes so important to help us to figure out. You can't judge a patient by the way the patient look, right? So you need to see the inside to figure out whether the plaque buildup or not. You look healthy doesn't mean that your vessels are healthy. So it's very important to have this type of very advanced non-invasive imaging to help us to take care of our patient and advise them accordingly.
I think we're going to stop you here just because we went over a little bit in time, but thank you so much for coming and joining us today. That was a great presentation. Just as a reminder for everyone else that's still here, we have Tumor Talk tonight at 4 p.m. So check out the Lenox Hill Neurosurgery Instagram page. That's where you'll find that live streamed. Thank you again, though. Thank you, everybody, for coming. Have a great day.
Okay. Thank you.